If I don't agree with court-ordered medications, should I leave psych nursing? Court-ordered medications are such an incredibly nuanced situation. Or just forced medications in general, like if it's an emergency situation or if the patient has someone else that's making medical decisions for them. Morally, this is always something that I will struggle with because a lot of the time you are forcing medications on patients that genuinely don't understand what's going on. They genuinely think that these medications are going to harm them. So imagine yourself in those shoes, like you're confused or you're in a state of mania or psychosis and people are trying to hold you down and force medication into your body, usually with, via injection. But yes, if this is ordered as the nurse, it is within your scope and it is part of your responsibility to do it. So I do have to do this sometimes, unfortunately. I think my biggest issue with the entire thing is it's such a band-aid. When I started out, I was kind of accepting of the fact that, okay, we have to do this, and then the patient's going to get better once they have the forced medication for a little bit, and then they're going to be grateful that they got help. That's the case sometimes, but I think to me, it all just feels so temporary, and it feels like this is just not really helping the patient. So many people with severe mental illness face so many systemic barriers to their health and wellness and recovery, and that is reflected so much in the work that we do and the amount that we see the same people. Like, why am I forcing medications on someone who, when they leave the hospital, they have no support system, they don't have the money to pick up their medications get stolen, they lose them, they don't remember to take them, and then they're right back here a few weeks or maybe a few months later, and we're doing the same thing. I think I could maybe feel better about forcing medications if I felt that that truly helped the patient in their journey to wellness and recovery and whatever that would look like for them, but so much of the time it doesn't. So we're just adding psychiatric trauma on top of all of their other issues.